You're going to hear lots of good and bad things about the epidural, but today we're going to talk about some weird side effects that people do not expect. In fact, one of these actually happened to me on my first baby, and it really freaked me out, so I don't want that for you. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I've helped thousands of epidurals. So I'm excited to give you guys this information so that you are not caught off guard. In fact, if you want to know this type of information for all of the rest of your pregnancy, laboring at home, birth at the hospital, and postpartum life, come join me in the online prenatal class for couples. In fact, you can save 10% today using coupon code epidural. Check it out. The first thing that people do not expect is their blood pressure drops. Now, this happens because your body is so tense and you're just in a ton of pain, and then we give you the epidural and your body just relaxes. And of course, your blood pressure drops. Now, we try to prevent this by giving you extra IV fluids before you get the epidural, and in every person it really varies. There are also medications that we can give you if your blood pressure drops. Now, one of the weird things about this is that you, the patient, knows that your blood pressure drops, even if I'm frequently taking your blood pressure. So if you start to feel or ringing in your ears, my mouth tastes kind of funny, and I just feel like my life force is draining into the mattress, let your nurse know, because she can quickly give you the medications and increase your IV fluids to let that blood pressure come up, and you can feel better really quick. The second thing a lot of people get is shaking. Now, shaking like you're nervous, and we don't really know exactly why the shaking happens. There's a couple of things. First off, relaxing. Second of all, being nervous. A lot of people shake sort of like nervously while they get the epidural, but your body will just naturally shake after you get an epidural. It could be the cold fluids going right next to your spinal column, and usually it wears off within about a half an hour. The best thing to do is to try not to prevent it. I know that you want to be like, no, I'm going to stop shaking, but you really can't do that. So just try and relax, take some deep breaths. And one of the other tips is to stick your tongue out, because your body will naturally not shake when your tongue is out. I'm guessing so you don't like bite your tongue. I have honestly no idea, but it's a good thing to try. But try it and take some deep breaths, relax into it, try and get a nap. I mean, that is the big win after an epidural, is to try and get a nap. So if you can do that, usually your body relaxes and the shaking goes away. There are some medications we can sometimes give that help, but relaxing is usually the best thing. Another thing you can do is to get a warm blanket. A lot of people don't know that the hospital has a blanket warmer with warm blankets that we can put on you. The shaking usually isn't due to the fact that you're cold, although you might feel cold because of the cool fluid going right next to your spinal column. But a lot of times it just helps you relax and maybe get that nap in. Okay, now another related one is that you might get a tiny fever. Now, I'm not talking like a big fever, but again, because you have that cool fluid going right next to your spinal column, your body's thinking, we need to up this temperature. So you might feel some fevery type symptoms. Definitely let your nurse know if you are feeling that, because it can be a fever and we don't want that. Usually we're taking your temperature every 1 to 2 hours, but if you feel fever-like symptoms, let your nurse know. But know that if she takes it and you don't have a fever, it could just be from the epidural. In fact, there are other medications that we can give you, like Cytotec, that can increase your temperature a little bit as well. Now, before we keep going, I have a whole post over on my website about keeping movement going even when you have an epidural. I would 100% recommend checking it out. I'll put the link down below. Okay, the next thing that a lot of people experience is itching. Now, this is probably due to the narcotics that they put in the epidural, and it usually wears off by a little bit, but it can be really annoying. There are medications that we can give similar to Benadryl to see if that can help. My favorite thing is to give patients just a dry washcloth, because I don't think we use fabric softener in the hospital, but to use it to itch is a lot better. And again, if you can try and get that nap in, usually by the time you wake up, all of these weird side effects have gone away. But a lot of people feel the itching and it's super annoying. So if you're in that category and it's driving you insane, ask for some medications. They usually have Benadryl already ordered if you're getting an epidural. There are other medications that they can give you as well. Okay, this is kind of a weird one that people are like, well, of course that's going to happen. But a lot of people are really surprised by how numb they feel, or they ultimately just don't like the feeling numb. Now, of course, it's kind of silly, because you know that is the idea with the epidural. The idea is that from your bra line down to about your knees, we're hoping to numb that area so you just don't feel as much. About 80% is what we're hoping to take away the pain. But a lot of people don't like how numb they are. Now, there's two things. First off, I love a good, strong, numb epidural at the beginning to try and get that nap in. And then once you've had that nap, we can actually change how we use the epidural and kind of lighten it a little bit. They will also likely give you a little button that you can push if you're having increased pain. So talk with your nurse if you just don't like how numb you are, you want to be able to move your limbs a little bit more, and you guys can figure it out. Of course, when we lighten the epidural, sometimes the pain comes back, but we can increase the epidural as well. So don't feel like just because you went lower on the epidural, you have to stay that way forever. Now, the one thing that everyone always tells me when I post this online or my article that I'll link down below is that back pain is caused by the epidural. Now, when you get an epidural or even an IV, you are going to have some pain in that area for the first 1 to 2 to 6 weeks, right? It is a bruise. If you're a sewer, you know that you might jab your finger with a pin and that area is sore and bruised for a little bit of time, right? So it's very normal for the first few weeks for that to be kind of annoying when it's hit by the shower or you sit wrong in a chair. You are going to have a little bit of back pain in that area. However, there has been a study done that took moms who got an epidural versus moms who did not get an epidural, and the long-term back pain after, gotta remember, it's after pregnancy, delivery, and postpartum, where a lot of times we just don't have the best body mechanics and we're hauling a car seat around. They found that there was not an increase in back pain in those who got the epidural versus those who went naturally. So I think that's something really important to know. I know a lot of people blame a lot of back pain because they got an epidural, but then you'll also see people in the comments saying, no, I did not get an epidural and my back still really hurts, because motherhood is a lot on our backs. Pregnancy is a lot on our backs. Labor is a lot on our backs, especially pulling our legs back or squatting. That can cause some issues with our body. And so if you're having long-term back pain, I would 100% recommend going to a physical therapist to see if there's anything that they can do, either change the body mechanics of how you're living with baby or stretches you can do to help those muscles. I know a lot of these things, like my blood pressure dropping, I was sort of afraid to say something, but I think it's really important that if anything in your body is changing, be sure and let your nurse know so that she can either explain it or change it or help you out. And when you're ready to get prepared for labor, birth, postpartum, come join me in the online prenatal class for couples. Remember, you can use coupon code EPIDURAL to get 10% off. If you enjoyed this video, please give it a thumbs up, and I would love to hang out with you for the rest of your pregnancy, so please give me a follow. And I have tons more videos out there. I hope you'll like some of them too.